I want to show you a couple cool things that really can help with low back pain. Of course, you want to check with a doctor, make sure this is right for you, especially with foam rolling. But the second part, I'm going to show you some stretches that you can do for your low back. Really, really helpful. I love a good foam roller. It's really kind of a bit of a challenge to do on your low back for low back pain, but for the entire spine is just getting your back through something. We use what's called rumble roller. It's one of my favorite rollers. And what does the roller do? Okay, when we get a roller through our spine, it does a lot of cool things. It gets blood flow back to the area. It can help with muscle spasms, and that's resulting in a decrease in pain. Okay, when I roll, I also get some joint cavitations, so I'll feel some rib heads and some other things start to pop, and it's very good. This is the essence of chiropractic as you go through these types of things. But a couple easy ways to start on a foam roller. It's just coming from your butt, getting this foam roller close here, and we kind of just start to bridge ourselves up, okay? Where we work back and forth on this low back. Just start easy. You can start with a seated up position and kind of roll back and forth to get to even more extremes with getting your hips up and a little bit more pressure in there, okay? So that builds quite a bit of pressure on the low back, but can feel really good. If you have a disc issue or something like referred pain down your leg, this might not be indicated, so be careful with that. But just for some generic work on some low backs is a really good way to put into your routine on a regular basis. The second part, some just real easy stretches that I like to show patients that really help. I call them windshield wipers, okay? And just like what you would think is we use our legs for windshield wipers. So just laying on a good hard surface here, we're gonna actually take our hips and roll back and forth, okay? This also does what we call imbibition of the lumbar discs, nice and slow. You can see I'm alternating my hips side to side, okay? Nice and slow. That imbibition is basically from the root word imbibe, which is to drink, but it's to get fluids. And so it's just actually mimicking like you're walking or some sort of movement when you're not really moving a whole lot. So if you have some low back pain, maybe some disc issues going on, the windshield wipers are a great mobility routine. Two things that you can add in: foam roller, those windshield wipers. You may put that in the morning routine, maybe even as you get out of bed. I tell patients all the time, just throw the sheets off and do those windshield wipers. It's a great way to get those joints lubed up, so to speak, the disc pumping, because they get their nutrition and oxygen through movement before you even hit the ground. Great morning routine. Jump on a foam roller. If you're an exercise enthusiast, you know that this has got to be part of your routine. It's really helpful. Hope that helps.